Hi everyone, Elise here. I'm going to be going through your first presentation of the course, which is what is craniosacral therapy. So before heading into the course and diving into all of the anatomy and physiology, as well as all the treatment techniques and palpations, it's important just to have an overview in understanding what this type of therapy is and why it's so effective. All right, so what is craniosacral therapy? It is a gentle, hands-on approach to evaluation. So when we say gentle, we mean gentle. There's no forceful mobilizations in cranial. There's no adjusting. That's more of a chiropractic terminology where you're going to adjust bones. In craniosacral therapy, we are gently inducing movements into the bones. We use craniosacral as an evaluation tool, so a way to assess what the horse is doing and how the bones are actually sitting in the cranium as well as throughout the spinal column. And we also use it as a treatment. So it can be both used as assessment and treatment. And it'll be treating primarily the craniosacral system. So the craniosacral system is comprised of the bones, the membranes that attach these bones, as well as the cerebrospinal fluid that circulates around the spinal cord and up around the cranial bones. The CSF, which we'll be referring to in this course, cerebrospinal fluid, it's always circulating, and the job of that is to protect the brain and the spinal cord. So we're going to teach you how to pick up these rhythms, but just so you get a sort of understanding, we're working with multiple layers here. So the bones, the membranes, as well as the fluids that are moving around. When we work with the cranial system, we are supporting the nervous system. So that includes the central nervous system, CNS, the autonomic nervous system, ANS, and then the peripheral nervous system, because the spinal cord feeds into all of the nerves that supply the rest of the body. So that would be out to the periphery. Therefore, working with the one craniosacral system actually supports the entire body because it's all connected via the brain and the spinal cord. Cranial utilizes the natural and inherent rhythms of the bones. So the bones actually have their own movements that they're going through cycles of every single minute. We're going to teach you guys how to pick that rhythm up and then utilize it to treat. And we can determine areas of restriction or areas that are lacking balance just by understanding how to pick up that rhythm. The great thing about cranial is we're just complementing the body's natural healing process. So we're going to go deep into this for the course, but the take-home message here is that the body actually has the ability to heal itself. What we are going to be teaching you is how to provide a fulcrum to support the body and the bones into moving where they need to go. It's great. It's super effective because we're not trying to get in there and muscle our way through. We're just supporting the body in something it would already be doing. This can help to treat injuries, traumas, disease, as well as chemical exposures. Because of the connection with the central nervous system, we're able to affect lots of the organs in the blood and the nerves just through working with the cranial system. This is what I love most about cranial, is that we are seeking to address the root cause rather than treating symptomatically. So treating symptomatically looks like we see an area that doesn't work and we run to that area and try to fix that area. So if the horse is limping and they look lame in the front right, let's say, that would be us running to the front right, assessing the shoulder down into the fetlock joint, and then treating what we find in that region. Craniosacral therapy, on the other hand, will say, let's check the entire body and figure out why it is that this horse is going lame on the front right, because we already know it's going lame on the front right, and obviously those tissues are going to be affected by the lameness. But we want to figure out what's going on in the rest of the body that could potentially be causing it. So I love this therapy for this reason, is that we're looking at the whole body as a whole. And 9 times out of 10, the problem and the root cause is not near the site that we see the symptom turn up. So we can get some pretty profound changes through the whole body if we treat in this manner. As far as equine craniosacral, the equine cranium has between 34 and 37 bones. This is different based on different breeds. We'll go into that. Mainly for them, head traumas are the most common cause of cranial dysfunction. So because they're a horse and they're living in different types of environments, whether it be stall or paddock or even out in a herd, they are going to be more prone to these head-on injuries or pullback, tieback sort of injuries, you name it. There's lots of situations our horses can get into. So typically head trauma is the main cause of a cranial issue, but that's not to say that other issues can't be causing that as well. With horses, when they do have a craniosacral lesion, we'll call it, or a dysfunction, they will have a very predictable, localized, regional, and systemic effects. So that means that there's going to be a very predictable pattern of pain visible. There's going to be predictable dysfunction in the area, excuse me, and there's going to be a systemic effect. So meaning throughout the blood vessels and the nerves of the whole body, you can see this effect. So this is why we treat the whole body and assess the whole body, because we want to see what's going on everywhere. Some of the common applications that are used, craniosacral is used for, is all types of different headaches. So this is great for humans too, because of the connections of the membranes inside the cranium. So I have my human cranium here. Because of all the connections that are actually happening deep inside the cranium here, that can have a huge effect on the blood vessels coming in and out of the head. So by treating the cranial bones or the membranes, we're able to free up blood vessels sometimes if that's the cause of the headache. We also use craniosacral to help with the motor coordination, sort of neurological stuff, because of the spinal cord and the fact that it's attached to the brain and the same membranes. Now, tagging on to that, we can also affect digestive issues because of vagus nerve coming out of the cranium, which is going to be feeding into all of the organs of digestion. So it really extends throughout the whole body, all the things that we can treat just by accessing the cranium, which houses all of the neurological tissue that feeds the rest of the body. Now also, craniosacral can be absolutely used to treat orthopedic dysfunctions. So orthopedic meaning just like a soft tissue injury, a sprain, a strain, or a tendinopathy. Of course, we can use craniosacral to treat that and also check the rest of the body to see if there's any other effects going on. In humans, cranial is used very frequently for TBIs and concussions. Getting into the spinal issues, I mean, this makes sense because, as we said, the spinal cord runs the whole course of the body. So treating any of these spinal issues such as scoliosis, the spondy group, so those are all the various different spinal disorders that can show up. By treating the spine, we can affect these systems positively. Then we get into sort of the systemic issues that people and horses experience, like the fatigue, emotional difficulties and stress, some of the connective tissue disorders. Again, because we're able to affect the central nervous system, we can have an effect on various disorders that are systemically related. Lastly, just some more examples. These ones are more human-based. So we have Alzheimer's, Parkinson's, spinal cord injuries. You'll notice that these are all part of the neurological group of disorders in humans. It is also used to treat pre and postnatally. It can be very, very helpful postnatally, especially if there was a traumatic birth for the baby or for the mom having the pelvis be affected. So we can also help with that, as craniosacral, as is the name, extends to the sacrum, which is the base of the spine. So we can affect changes down into the pelvis by treating the system. So who practices craniosacral therapy? There's various different people across the world that are trained to practice craniosacral therapy. There's the certified craniosacral therapist directly from Upledger Institute. Now you can take those courses as a registered massage therapist, as a physiotherapist, or as a chiropractor. You can take those courses as an add-on, like a continuing education. You may also take those singularly, but if you take them singularly, it's a much longer program if you don't have a license coming in the first place. Osteopaths, so DOMPs is what we're called in Canada. Osteopaths are also trained in craniosacral therapy. Registered massage, physio, and chiro, I just explained that. So if you have that license, you can go on and get the further craniosacral training. As far as equine therapists, since we're in an unregulated profession here in Canada, there is no legislation on who may or may not practice this, because technically nobody is supposed to be practicing except the veterinarians. So this may change as regulations change, but at this point, there is no regulation on who specifically can or cannot practice craniosacral on horses. So a question that comes up a lot is, what's the difference in osteo and cranial? I have a lot of clients asking this frequently, so this is something I wanted to just touch on with you guys, and we can talk more about it in the live course if you attend. Basically, osteopathy and cranial, they are very closely related, even interdependent, some may say. Osteopathy is the treatment of the body as a whole. So osteopaths believe that the whole body is one interconnected unit that's working together. Osteopaths seek to address all the systems in the body. So where a massage therapist would be predominantly concerned with the musculoskeletal system, and a chiropractor would be primarily concerned with spinal alignment of the bones, and so on. Osteopathy is more focused on all of the systems. So we don't forget about the fact that there's a respiratory system, a circulatory system, an endocrine system, you know, where all the hormones are being produced, a cranial system, and the list goes on. Craniosacral is treatment focused on the craniosacral system. So that being one of the many systems in our body that osteopaths use, cranial is focused just on cranial, as the name says. So because cranial affects all the systems in the body, it sounds similar to what osteopaths are doing. The only difference is that the osteopaths are actually treating each system as well, right? If they come across that. So many osteopaths may assess and treat the cranial system and use craniosacral as one of their treatment techniques, one of their modalities, or they may use other treatment techniques and modalities that they deem necessary at the time. So by understanding these rhythms that we talked about earlier, these natural rhythms in the bones, craniosacral practitioners can affect a wider range of dysfunctions, and similarly, so can osteopaths. Okay, so that concludes what is CST. Next up, we're going to do a little bit of a brief history overview so you understand where all of these therapies started in the first place.